my slide should be coming up right now. Okay, so over the next few minutes, what I would do is talk a little bit about rare mutations in EGFR, specifically the use of Poziotinib for EGFR and HER2 exon 20 insertion mutations in advanced non-small cell lung cancer. So I would spend some time talking about the results from the expanded access program. I'm based out of Bangalore at AstraZeneca. I'm a medical oncologist. So this article was published in European Journal of Cancer in May 2021, and the background for this article is as follows. So in-frame is insertions of 3 or more base pairs in exon 20 of EGFR were among the first EGFR mutations to be identified as oncogenic drivers. However, unlike the more common EGFR L858R or the exon 19 deletions, which represent the majority of EGFR mutations in non-small cell lung cancer, low frequency EGFR exon 20 insertion mutations are unfortunately associated with a de novo resistance to targeted EGFR inhibitors and subsequently correlate with a poor patient prognosis. HER2 exon 20 insertion mutations have been identified in about 4% of non-small cell lung cancers and mutually exclusive with other driver gene alterations that are usually correlated with non-smoker status, female gender, and adenocarcinomas. So this is a major unmet need. So kind of to sort of give us all a baseline to compare this. The incidence of ALK mutations itself is about 4% in non-small cell lung cancer patients, and for that we have a whole host of medications, first gen, second gen, and third gen. So definitely the attention paid to EGFR exon 20 mutations has been low in the past, and this seems to be a major unmet clinical need. Poziotinib is an orally available, irreversible, covalent tyrosine kinase inhibitor. Although Poziotinib shares a similar quinazolone backbone with afatinib and dacomitinib, because of the smaller size, increased halogenation, and flexibility of the drug, Poziotinib can circumvent the steric hindrance in drug binding pockets induced by HER2 or EGFR exon 20 insertions. So this study aims to evaluate the clinical efficacy in non-small cell lung cancer patients harboring exon 20 EGFR mutations or HER2 insertion mutations in a real-world setting. Again, my slide has frozen. So, non-small cell lung cancer patients who were treated with either EGFR or HER2 exon 20 insertion mutation within an expanded access program were included in the study. Poziotinib at a dose of 60 milligrams or less was administered orally. 22 patients were started on at a dose of 16 milligrams. 6 patients had to undergo a dose reduction to 14 milligrams. One patient had a dose reduction of up to 12 milligrams and another at a dose of 10 milligrams. Dose reduction for toxicity was allowed up to 8 milligrams, which is 50% of the starting dose. The primary endpoint was the overall response rate. The secondary endpoint were median PFS, disease control rate, median OSS, and toxicity. So if we look at the result table over here, the thing that we want I want us to pay some emphasis to that about 70% of the patients had the EGFR exon 20 mutation. So that was one. The second thing is that majority 95% of the patients had baseline mutations, and nearly 40% of the patients had liver metastasis, which means that the disease biology was a bad disease biology. Also, nearly 50% of the patients included in this study had a CNS metastasis at presentation, which could probably give us a fair idea of the activity of this drug in patients with CNS metastasis. So, when we talk about the results and the treatment response, 13% had a primary disease progression. 50% of the patients, which is 15 out of 30 patients, had a stable disease, and 30% of the patients had a partial response, which means that the total disease control rate was nearly 80%, and this including all patients with a baseline brain metastasis. The intracranial overall response rate and disease control rates were nearly 46.6% and 80% respectively. Among the patients who were radiation naive, 2 patients had partial remission and 1% stable disease. which was what was reported. So this is the waterfall plot looking at the percentage change in the tumor burden. We can see that there was a reasonably significant percentage change in the tumor burden. So at a median follow-up of 9.5 months, and the data cutoff was 15th May 2020. 73% of the patients had experienced disease progression and 40% of the patients had died. However, the median progression-free survival was about 5.6 months, and the median overall survival was 9.5 months. On multivariate analysis, ECOG performance status of 2 and male sex were confirmed as the negative prognostic factors. Now, ECOG performance 2 was obviously is obviously a poor prognostic factor, but the reason for male sex being a negative prognostic factor were not uh, could not be explained completely. The one thing which really stood out was the overall survival in this setting, which was nearly 9.5 months in a very difficult to treat subset of patients. So there were no differences were found in patients who received Poziotinib in the first line compared to those who received it in the second line or further line. So this is again another indicator of the biology of the disease, which states that EGFR exon 20 has got uh, uh, the driver pathway in this type of non-small cell lung cancer is not completely identified, and we definitely need to do better in this subset. So, important part of this expanded access program was looking at the toxicity profile. Unfortunately, 89% of the patients ended up having dose interruption, and more than three-fourths of the patient study population had to undergo a dose reduction. And the dose reduction and interruption came primarily from two side effects, that was diarrhea and skin rashes, and to a extent mucositis, which was nearly seen in about 50% of patients who had a grade 1 mucositis. So, moving on to the discussions of this study, uh, if we want to compare this expanded access program with a proper phase 2 trial, the Zenith 20, which has been reporting results starting back from last year's ASCO, was, Zenith 20 was a phase 2 study which tested for efficacy and safety of Poziotinib in non-small cell lung cancer patients with either EGFR and or HER2 exon 20 insertion mutation. So the results from cohort 1, the cohort 1 of the Zenith 20 study looked at patients who were pre-treated that did not meet the primary endpoint with the overall response rate of only 14.8%. Although the patients who did achieve a response had a durable duration of response of nearly 7.2 months with a median PFS of 4.2 months. When we compare this to our own study, and mind you, this is still just the results of an expanded access program and not a proper phase 2 or a phase 3 study. The PFS in our study was definitely better than this. The important thing in Zenith 20 was that the starting dose was 16 milligrams, and about 65% of the patients indicated dose reduction. In the current study, in a similar patient population, it has definitely shown a better overall response rate, a better disease control rate, and a better progression-free survival in patients with the exon 20 insertion mutation. Despite the longer reported progression-free survival compared with Zenith 20 and also median PFS, unfortunately, in the large scheme of things, this remains low because we definitely expect more from a targeted therapy, especially in light of what we are seeing from the FLORA trials and experience of osimertinib in the L858R and the exon 19 deletion patients. Definitely better PFS and OS in a target therapy driven trial. The significant differences in overall survival between male and female, which was observed, which confirmed male as a negative prognostic factor, but the biological mechanism to explain this is still unknown. However, more number of females represented the study population as and small sample size can be a factor causing bias. There are other similar molecules to this, namely mobocertinib, amivantamab, and pyrotinib, which have been explored in this difficult to treat setting. So I close my talk with some of the take-home messages. The first is EGFR or HER2exon 20 insertion mutations comprise a significant percentage of patients, which is nearly 4% of non-small cell lung cancers. In India, at least, the more we test, the more we are able to identify this. And end of the day, this might be equivalent to the number of ALK positive patients that we have. Poziotinib and other tyrosine kinase inhibitors targeting this subgroup have shown encouraging results but have fallen short of expectations. Mainly, the progression-free survival is definitely lesser than what we would have expected in a target therapy-driven trial. The important take-home message from this study is that the appropriate dosing is yet to be determined. We cannot have a molecule wherein 75% of the patients need to undergo sort of dose reduction, and especially having done this study in a Caucasian population, if we try and extrapolate that to a South Asian population, the dose reduction and the ideal dose will definitely suffer even further. At a more molecular level, the definition of a HER2 positive non-small cell lung cancer is insufficient, as it does not recognize the fullest intricacies of these genetic alterations. Not separating these alterations from the same cohort analysis would probably have been the reason for failure of the many different molecules in previous studies. I would like to close my talk at this stage, and I'm happy to take any questions. Thank you.
Thank you very much, Dr. Aditya. I think we'll have the questions at the end if we have time. Am I audible? Can you hear me?
Yes, sir, you're audible.
Great. So if we could continue the session, this is Hemant Malhotra signing in from Jaipur. Apologies for the little bit of delay. I was tied up in something. So we'll continue the session, and it's a pleasure for me to invite the next speaker,